Hi, my name is Shantae Mitchell, and today I will be showing you guys how to do a dressing for a breast reduction. So this is my patient. I have a picture of the actual breast reduction incision. So the incision would be right below the nipple right here. And a breast reduction, also known as a reduction mammoplasty, is a procedure to remove excess breast tissue, fat, and skin to reduce the size and weight of the breast. It also helps with, um, it alleviates physical discomfort such as back, neck, and shoulder pain. So I'm going to move that out of the way and we're gonna, for the sake of the argument, put the incision right there. So you get a broader uh, picture of what I'm trying to do. Um, Prior to the procedure, I would do an initial rinse. If there's blood or anything around the patient's skin, and it would be gently um, removed. So I have napkins here to use as a sterile gauze pad or soft cloth soaked in CHG, or a solution to gently wipe or dab the skin around the wound. So I wouldn't wipe this incision. I would just dab around it so I wouldn't break any of the skin around it. So this would be the one with the solution on it. And then I will also take another soft cloth and dab around the incision. And for the prep solution, I would choose the CHG. It's an alcohol-based form, and it is less likely to be deactivated by blood. So I will also use that. Um, I will let that incision around the incision give it time to dry. And next, I will start to place my gauze on the incision. The gauze I chose to use is a non-stick gauze pad. The gauze dressing would be placed over the incision, and then an elastic bandage or surgical bra would be wrapped around the patient's chest. The gauze, it acts as a barrier for protecting the incisions from external contaminants and minimizing the risk of infection. For the elastic bandage or surgical bra, it applies a compression to reduce swelling and supports the newly shaped breast to minimize strain on the incision. And the gauze is there to help absorb any initial drainage from the surgical site. So I had it's like a trans transparent dressing laying around the house, so I'm gonna use this. Is this the one? Maybe not. Okay, here we go. So I'm going to place this right. It says to place it right over the incision, so I will place it right there. Also, after a few days, the initial dressing are typically replaced with clean ones, which may include adhesive sterile strips directly on the incision. This is for to help keep the edges of the incision together, promoting optimal healing and minimizing scarring. Uh, So with the non-stick, since this can stick, but with the non-stick gauze, I will also use tape in order to tape down to make sure that the incision stays in place. So I will put tape around the incision to keep the gauze from moving. And for breast reduction surgeries, it is up to the surgeon if they want to use a drain mechanism or not. Different ways that a drain tube coming through the skin is dressed separately is with the JP draining dressing. These closed suction drains require less frequent dressing changes than the Penrose drain. Dressings are used to protect the drain incision site, secure the drain, and monitor the drainage volume. The dressing material should be absorbent to manage any potential drainage around the insertion site. So again, my initial dressing would be a gauze placed around the incision, then an elastic bandage or surgical bra wrapped around the chest. After a few days, the initial dressings are typically replaced with clean ones, which may include adhesive strips or steri strips applied directly to the incision. And that's my presentation for my breast reduction dressing surgery. Thank you.